Dave, why do you want the chance to take GM604?
I have had ALS for 2.5 years, and based on my progression, will pass in the next 6 to 12 months. There are no drugs in the pipeline for approval in that window, and most of the drugs under investigation at best treat the symptom and not the disease. The early clinical trial of GM604 resulted in a significant slowing or even cessation of progression in 7 of 8 treated patients. When GM604 was given to one other patient outside the clinical trial, he saw modest but measurable improvements in function. If Chenervan is forced to go through a phase 3 trial before approval, it will take 3 years, and I, together with 15,000 ALS patients in the US and 300,000 worldwide, will die.
This drug has not passed clinical trials. Doesn't it concern you that it could be harmful to you?
GM604 has been given to 32 healthy volunteers, 9 ALS patients, 26 stroke victims, and 4 Parkinson's disease patients with no adverse events. The safety has been demonstrated. But even if there was not such a strong body of evidence for safety, I would want all ALS patients to have access to GM604 because our disease is 100% fatal, and the tolerance of potential risk versus reward should be a decision left to the patient in consultation with his or her doctor.
What do you think GM604 could do for you?
I believe that GM604 has the potential to stop my progression and perhaps restore some of the functionality I have lost.
Dave, what's your condition now?
Before getting ALS, I was a university professor and a distinguished lecturer for the Groundwater Resources Association of California. In the last year, one have entirely lost the ability to speak. 4 years ago, I completed both Ironman New Zealand and the Boston Marathon. Now, I am restricted to a wheelchair, unable to run, walk, or even stand. I cannot swallow more than thin liquids, so I take my nutrition through a feeding tube into my stomach. I have lost the use of my lips and most of the use of my arms, so I can no longer hug or kiss my wife, daughter, or grandson.
And finally, how is it affecting you knowing that there's a drug out there that may help you, but you aren't allowed to take it?
It tears me up, largely because of my family. Can you imagine the impact on them if, 2 years after I die, results of phase 3 testing confirmed the early results that GM604 would have saved my life? It also frustrates me because I can't see the logic of denying access to a drug to a population afflicted with a rapidly progressing disease that is 100% fatal.
Dave Huntley, thank you.
Thank you for inviting me.